Thanks for joining us for News 8 now at 6. I'm Ken Kozarowski.
And I'm Amy DuPont. Data from the Kaiser Family Foundation says health insurers in more than a dozen states are increasing their costs.
News 8 Now's Rob Romano spoke with a healthcare advisor about this trend. Rob.
Amy and Ken, here in the city of La Crosse, a company called Strive Medicare helps pair seniors with the Medicare insurance plan that suits them. The CEO of that company, Rick Teska, has worked in the insurance field for 39 years. He says the rising cost of health insurance is the result of multiple factors.
There's 10,000 people turning 65 a day. So that's a huge amount of people that are aging and that obviously affect costs as well.
From an aging population to new medical technologies to the sheer volume of pandemic-era hospital stays. Rick Teska, CEO of Strive Medicare in La Crosse, says the rising cost of health insurances can't be blamed on any one thing. He says the fact that more people are unhealthier could also be playing a role.
As those people age, they become more unhealthy, and as we historically have become more an unhealthy society, if you will, unfortunately, all of those things compounded together are going to drive up costs.
More than 13 million Americans get their health insurance through the Affordable Care Act. In 2021, the American Rescue Plan expanded the amount of people who could get a subsidy under the ACA, reducing the cost of insurance for millions on the marketplace. President Biden's Build Back Better agenda calls for funding to maintain current subsidy levels. Teska feels that instead of larger pandemic-era subsidies, the government should have helped Obamacare recipients pay their deductibles instead.
If they needed help to begin with, who's paying those large deductibles? You know, is it still shifting that cost back to the people?
On the issue of Medicare, Teska says he's seeing the highest increase in prices ever.
The premiums that everybody pays last year in 2021 were $148.50 a month, and now this year they already went to $170. That was the biggest monthly premium increase that Medicare has taken historically.
And Teska stresses that anyone in the process of enrolling in new health insurance coverage should talk to a health insurance advisor. Amy and Ken, back to you.
All right, thanks a lot, Rob. Some insurance companies attribute certain price increases to inflation.
Outside of private insurance, the cost of maintaining that pandemic-era Obamacare subsidy is about $22 billion a year. Again, unless it's extended, it ends at the end of this year.
All right.